Hello, I'm Dr. Brou, and today I want to talk to you about tummy tucks and the recovery, which is the most important part. And I have a lot of patients that ask me that question all the time, so I wanted to go over the recovery time one more time. And so a tummy tuck is a rather large operation, and the other thing is that it's not always done all by itself. So as a matter of fact, the great majority of times is done with other procedures such as liposuction, sometimes breast augmentation, lift, or even reductions. So it makes the recovery a little bit more complicated. But in itself, the tummy tuck or abdominoplasty as we know it is an operation that takes about an average 3.5 hours. If it's done with liposuction, it may take 4.5. Sometimes I use fat grafting to the buttocks to enhance the contour, and that adds another 30 minutes. A breast augmentation will add another hour, and mastopexy or breast lift would add 2.5 more hours. When that happens, I usually keep the patient overnight in the surgery center, and we do a checkup the next morning. So a plain abdominoplasty or tummy tuck will take 3.5 hours, and most of the time the patient can go home the same day. I use a compression garment after surgery because there's always a little liposuction or a lot of liposuction involved, and therefore the garment along with drains, and I use drains in my abdominoplasties, will make the first week of recovery a fairly uncomfortable one. We usually send patients with pain medication home, and after the drains come out, generally the pain gets better and the patient starts being more mobile. Most patients will take pain medication for about 2 weeks, and the other thing is that the garment is worn for about 4 weeks, so that adds to the recovery time. So most of my patients will turn around at 2 weeks, so that is at 2 weeks they will feel much more mobile, they will be able to drive, and sometimes walk for a little longer walks, and maybe even get into a very mild treadmill exercise program. I don't advise to go back to regular workouts until at least 3 to 4 weeks out, at which point you can start doing a little bit more involved exercise. But in general, like I said, the first week is the worst week. The garment is uncomfortable. You will take pain medication. There's going to be some drains involved. And I usually don't use a pain pump, which is a device with catheters for abdominoplasties, but I use the injection of Exparel, which is the long-lasting local anesthetic I inject around the muscles. As this diagram shows, the muscles and the tummy, they do get spread out with pregnancies, and with the abdominoplasty or tummy tuck, we tend to suture them together. And this is the source of the most pain from the surgery and what takes the longer to recover from. Having said that, I want to bring up the fact that because of the tightening of the abdominal skin with the abdominoplasty along with the muscles, most patients will walk hunched over for about a week's time in general. Some take a little longer, some take a little less to straighten up fully, which is desirable. The straightening out will happen within a week, like I said, and you do want to be able to straighten up so your back won't hurt that much. And so that's the main thing. So in the first week, there's going to be drains involved. You're going to need to get used to wearing a garment, and there's going to be a lot of swelling. At the end of the first week, most of the drains will be gone, and therefore you can move around better. And at the end of the second week, you'll probably be able to stop taking pain medication and do a little bit more involved activities such as driving, walking longer distances, and maybe some very light exercising. At the end of the third week, you're going to feel more like going into the gym. You're going to be walking straighter. And at the end of the fourth week, you can start wearing the garment part-time and not full-time like for the first 4 weeks. So that's in a nutshell the recovery from a tummy tuck. And like I said, sometimes that's combined with breast surgery, which will require the wearing of a sports bra for about the same length as we wear the compression garment. If you have any questions, feel free to get into our webpage, which contains a lot of information about it, or feel free to call our office for further advice. Thank you very much.